Not much. Not much. Just avoiding writing my intervention plan.
I should really be doing that, but Victoria's Secret has so many nice bathing suits, and I need it for next week.
Are you going somewhere on spring break?
Well, I'm going down the shore, so
that's fun.
It's going to be chilly, but I'm determined to get myself a bathing suit.
Dude, definitely.
Did you get this email?
I have an unread email. Hold on. Definitely an RA email.
Oh, figures.
Should we look at it anyway?
Why not?
Oh, this looks kind of cool.
Oh, what is it?
It's about traumatic spinal cord injuries.
Okay.
Should help us in health conditions.
Oh, cool. Let's take a look. You're going to have to navigate this. I'm not a Mac person.
Okay.
So, what does it say?
It's called Conscious 101.
Oh, cool.
And it says that traumatic spinal cord injury is an injury that could severely impact one's health, quality of life, and could potentially be fatal.
Oh, God.
So why are they sending it to us? Better information for the general population on what traumatic spinal cord injury is.
Oh, look, they have
Picture spring break.
Oh, yeah.
Plan on getting and doing some of your favorite activities. Make sure to browse our site. Huh.
Okay, cool.
So,
I guess we should just go to the first tab.
yeah.
Yeah, because I'm not really sure. I'm ashamed, but I don't know what it is.
Spinal cord anatomy and physiology.
Oh my gosh.
So, basic anatomy and function. The cord is surrounded by vertebrae. The meninges protect the spinal cord. And it has an outer layer with white matter called the myelin sheath, which conducts impulses that are triggered by the sensory stimuli. An inner layer called gray matter, comprised of nerve cell bodies. And a central canal where cerebrospinal fluid circulates. This is really cool. Oh look, it's a dermatome map.
Oh, yes.
The spinal cord is comprised of many nerves. They carry signals to the brain controlling voluntary movement and sensation. Well, I could see how that could be a large problem if something is injured.
What does any of this have to do with going on
Spring break? I don't really know.
All right, well, I guess we'll just keep on looking.
So, oh, this is cool. So the cervical areas control really important things like breathing, head and neck movement, your heart rate, wrist and elbow movement. That could really impact someone's occupations. Then your thoracic area controls hand and finger movements, tone, trunk stability, and then all the way down in sacral, you still have more hip movements, knee extension. There's a lot of control all the way from the top down.
Interesting. Oh. Oh, so this is what it actually is.
Oh, okay. It occurs when there is significant damage to the spinal column. It may result from direct injury to the spinal cord itself or indirectly from damage to surrounding bones, tissues, and blood vessels. So there can be a lot of different symptoms depending on where you're actually injured. So from C1 to C4 is the highest level of injury. This could leave you being quadriplegic, tetraplegia. You could be on a ventilator for life.
Okay.
And you might only be able to shrug your shoulders. Wow.
Oh, that's really bad.
At C5, it's a little bit better. You may be able to have the ability to flex your elbows and can do some grooming activities. Whereas at C6, you can flex your elbow and your wrist. That would give you a little more help in being able to do things like transferring from a wheelchair on a slide board.
Okay.
So, it goes all the way through. And then in thoracic, you still have loss of typical, normal, and bowel and bladder control, numbness and sensory changes, spasticity. You can have pain and weakness. And this can cause things like pressure problems, abnormal sweating, trouble maintaining typical body temperature. And in the lumbar area, you can have a lot of the similar problems. So, maybe this explains why it got sent to us. Motor vehicle accidents cause 46%. Wow, it's really high.
Good thing I won't be driving.
Right? Use of a seatbelt can reduce the odds of spinal cord injury by 60%, and with an airbag, 80%.
Oh,
wow. The rest are falls, violence, and sports. That seems, I guess you can do sports in spring break.
Well, I plan on going skydiving, so...
That could probably have a little bit of an impact.
Great.
Spinal cord trauma can be caused by a number of injuries to the spine, like diving into shallow water, industrial accidents, gunshot wounds. Direct injury, like cuts, may occur to the spinal cord, particularly if bones or discs have been damaged, if fragments of bone or metal can cut or damage the spinal cord, if the spinal cord is pulled, pressed sideways, or compressed, if bleeding, fluid accumulation, or swelling occurs inside or outside the spinal cord, compressing it and causing damage. Wow, there's a lot of ways it can get injured.
Oh, wow.
Oop, didn't want that. I wonder what the risk factors are.
Yeah, that's what I need to know. Oh, there we go.
There's someone. Is that what you were thinking of doing over spring break,
yeah,
Ashley?
possibly.
So, wow, about 200,000 people are currently living with spinal cord injuries in the United States.
Holy crow.
There are 15 to 40 new cases per million people. Oh, this is a good spring break one. Alcohol has been found to play a major role in 25% of spinal cord injuries.
Oh, gosh.
Now I see why they sent it to us.
So I shouldn't drink and dive?
No, no
Okay.
drinking and diving.
Okay.
Let's see. Males account for 80% of spinal cord injury impairments.
Oh, there we go. I'm a female.
Right. Most new spinal cord injury cases occur in persons younger than 30 years old.
Okay, that's
An estimated 50 to 70% occur in those aged 15 to 35. Well, sounds like college kids.
yeah, great.
And there's some ethnic distribution, with white being 65%, African American 25%, Hispanic 8%, and other at 2%. Oh, there you go, diving into shallow water. No diving for you, Ashley.
Oh, my goodness.
It can also be people with weakened spines.
Oh.
Let's see, some precautions.
That's a good one.
Safety practices during work and recreation can prevent many spinal cord injuries. Use proper protective equipment if an injury is possible. Check the depth of water before diving. It's a good one.
Oh, yeah, that is good.
Use caution when sledding and inspect for the area for obstacles. Use appropriate techniques and equipment when playing football. Take caution in work environments to avoid falls. Defensive driving and wearing seatbelts greatly reduce the risk of serious injury.
Oh, that's good.
Well, I don't know how you people from New Jersey do it, but
Hey,
we're pretty defensive in Connecticut.
Oh, yeah.
If you've had a spinal cord injury, continue to take precautions to avoid further harm. Daily pulmonary care, follow all instructions regarding bladder care, follow all instructions regarding routine wound care.
Oh, my goodness.
Keep immunizations up to date, maintain routine health visits with your doctor. There seems like a lot can happen if you have a spinal cord injury.
Seriously, there must be.
See how you diagnose and treat it.
Oh, wow.
Once a spinal cord injury is suspected, it requires immediate attention. A spinal cord trauma is a medical emergency. It requires immediate treatment to reduce the long-term effects. The time between injury and the start of treatment is a critical factor for affecting eventual outcome. But there's a huge role in acute care. The healthcare provider will perform a physical exam, including a neurological exam. This may include CT scans, MRIs, somatosensory evoked potential testing.
Oh my gosh, what is
Sounds
that?
really involved.
Holy
It's a
crap.
magnetic stimulation, may show if nerve signals can pass through the spinal cord.
Huh.
And there are spine x-rays.
Oh, yeah,
Some
what are they
treatments include corticosteroids, surgery, bed rest, spinal traction,
Oh, boy.
care of skin, bowel and bladder
Oh,
awareness,
my gosh, I didn't even think about that.
PT, OT, and other
Yeah.
rehab. Oh yeah, OT. Botox injections, painkillers, muscle relaxers, intubation.
Holy crap.
Wow.
Good thing they're sending this to us because I was
Right.
not aware. Here, let me look at this now. I'm going to try to control your Mac here. Oh, wow. Okay. So, complications. Wow, there are a lot. So, neurologically, there are... Oh, wow. So, any system in the body that can be controlled by the affective nerves. All right, so that's pretty much everywhere. So, Okay. Psychological, depression, anxiety, shock, loss of independence. I didn't even think about that. I guess if you,
not at all.
I could not imagine. Let's see. Physical, blood pressure change, kidney complications, bladder and bowel, and sexual dysfunction and pain. And, oh wow, I didn't even think of this. For immobility, you can get deep vein thrombosis. So we just learned about that.
We did just learn about that.
Pulmonary infection, skin breakdown, and contractures. Wow.
Wow.
That's nuts.
Cause significant
Yeah.
issues.
And then prognosis. Let's see. Okay, so how well a person does depends on their level of injury. Injuries near the top of the spine result in more extreme disability. Okay, that makes sense.
Yep.
Paralysis and loss of sensation is common. That includes paralysis, numbness, and varying degrees of movement and sensation loss. Death is possible. Oh my God. Recovery of some movement or sensation within 1 week typically means that the person has a good chance of recovering.
That's good.
Losses that remain past 6 months, though, are more likely to become permanent.
Wow.
Wow, bowel care will take 1 hour or more daily, and they may need bladder catheterization. Oh, and environmental modification may be necessary. You can do
Good place
that.
for OT.
Most people who experience spinal cord injury are wheelchair or bedbound and require a multitude of assistive devices.
Wow.
That's nuts. Who knew?
The bowel care could really have an impact on your habits and routines.
That's true. Oh, very OT of you.
Oh, thank you.
Oh, speaking of, let's go to the OT corner. We can come back to the 10 facts. Oh, so what can occupational therapy do? How cool. All right, so we can evaluate a person's ability and level of functioning in his or her home, at work, and while engaging in leisure activities and hobbies. We can determine how motivated a person is to participate in activities that he or she participated in prior to the injury. We can identify any changes in roles a person may experience as a result of spinal cord injury. We can provide individualized therapy. That's pretty cool. Oh, adaptive techniques. That's right up our alley. Facilitate coping skills. Implement exercises and routines that strengthen muscles that may have been affected. And also determine the type of assistive devices. Okay, so now I'll go back to the 10 facts. I'm sorry. I just had to look at the OT corner. It got me so excited. 10 facts.
It is exciting.
What to take with me on spring break. Okay. So let's review. A traumatic spinal cord injury is defined as significant injury to the spinal column as a result of direct injury to the spinal column itself or indirect injury due to the damage surrounding the bones, blood vessels, and tissues. The severity of post-injury signs and symptoms varies depending on if it was incomplete versus complete, as well as where the location of the injury is on the spinal column. The cervical area injury is most severe, and C1 through C3 usually requires a ventilator to breathe. And most patients between C1 and C7 are quadriplegic. Various levels of sensation and motor abilities may be lost at any level. Oh, in the Aegis scale, they use that again. Complications may include bowel and bladder infections, kidney complications, changes in blood pressure, sexual dysfunction, and pain. And then, due to immobility, it was a deep vein thrombosis, pulmonary infections, skin breakdowns, and pressure ulcers, and muscle contractures. And then this is the big one for us. Well, we're not male, but it does occur mostly in males, and it occurs between the ages of 15 and 35. So, like, we're right in between there.
Yeah, definitely.
And then risk factors, also important for us to know before going away, include participating in risky behaviors, not wearing protective gear during activities, diving into shallow water, and having a weakened spine. Car accidents are responsible for almost half of the injuries, but if you use a seatbelt and airbag, that can dramatically reduce your odds of injury.
Definitely be wearing my seatbelt over break.
Yeah.
Definitely.
And there are also many psychosocial implications, including shock, anxiety, and depression. It is a life-altering traumatic injury. Wow. I'm so glad they sent this to us.
Yeah, this was really helpful.
I know. I'll definitely keep this in mind because I don't know if I would have been as aware. I'm definitely more conscious of
Me too.
spinal cord injuries, and which is why I guess they named it.
Could really change
Conscious.
your life.
Wow. Alrighty. Well, I guess now I should get back to doing my homework.
Intervention plan.
Or searching for bathing suits.
Bathing suits.
Yeah.
Bathing
Alrighty.
suits.